Stuti Mheta, who would like to also introduce myself. I had done my MD in homeopathic or organon and homeopathic philosophy. Dr. Kishore Mehta used to come to our college for visiting lectures. I hope, sir, you remember me. And it was an honor to be present right in front of you right now and to give my speech today. Thank you, Dr. Kanak Teli sir, Meenakshi ma'am, Bhavna ma'am, and a very inspiring and motivational Dr. Deepika Kachchi ma'am to let me have a speech over here regarding this thyroid nodule. And let me start first that I had also been an assistant professor in Baroda Homeopathic Medical College for a brief period of time. Of how a thyroid nodule is. Any nodule or a growth in thyroid gland is thyroid nodule. So there are various categories and characteristics of it depending on the size, whether it is a solid or fluid is benign. But about 2 mm size, we have to always consider in our back of mind it can be met. A very small percentage of people only suffer with thyroid nodule, so it's not a big risk, but still. Next. We know that knowing the disease is good for us to maintain it and management of a disease. We can go forward with that. So here the causation also helps in further management of the disease. So iodine deficiency, we all know, happens to be the main cause for the thyroid nodule. The second one would be overgrowth of a nodule that can be either due to an excessive growth, a thyroid adenoma can contribute, it's also benign, not to be worried about. Any cyst formed in the nodule can be thyroid cyst. It can be because of a degenerating tissue, can also contribute to a thyroid nodule, benign, not to be worried. Genetic predisposition has been marked. Family history with having thyroid nodule has always been one of the factors to develop and a risk factor for it. Thyroid cancer, a small percentage of people suffer from thyroid cancer. And hormonal changes, sudden hormonal changes, especially in women, can contribute to a thyroid nodule, again benign, not to be worried. Radiation exposure early in childhood contributes to it. It has always been noticed that incidence of thyroid nodule increases with the age. So people with in advanced ages have come up with thyroid nodules. Now we can understand what an allopathic approach it is. So in allopathic approach, they will give thyroid hormone suppression therapy. So if TSH is elevated, they would try to bring it down. If there is like any radioactive iodine therapy has been given, they usually give ablations and surgical removal of the thyroid gland, and sometimes a thyroid nodule can be hyperactive. So hyperactive thyroid nodules may contribute to other symptomatic changes in the body. So there are various other symptoms which come up and we can give for that. The patient was not that familiar with homeopathic treatment. She was very, very skeptical, but she had come to me. She is a 66-year-old female patient, walks into my clinic with a thyroid gland with an enlarged nodule on the right side. For 1 month, she has noticed there is an external growth on the right side. It has no association with pain, there were no symptoms. She had visited several other doctors prior to coming down for a homeopathic treatment, wherein she found out that a surgical opinion was always thought of. She was little scared of going forward for a surgery, so she thought, let me try with homeopathy, and we started with the treatment. The physical journals of the patient was that her appetite was very normal. There was no change in her appetite. She has a craving for spicy food, sweets, and lemon juices for day-to-day routine life. So, and perspiration was profuse on face, scalp, and little sweaty palms were noticed, but not affecting the patient much. She said that whenever we ask a patient, okay, any sun exposure or harsh sunlight creates any problem, she says sometimes it creates headache, and the clear thermal state of the patient was not known, so we counted it as an ambithermal one. The patient used to prefer more of a cold weather. She used to not like covering even in winters, and should take baths with only warm water in summer. So that was little dicey, sun headaches and all. Menstrual history, she got menopause at age of 48 with menorrhagia. So not much details were asked that moment. On examination, the thyroid nodule was very firm and masked on the right side. It was movable on swallowing. Past history of the patient suggestive of tonsillitis in childhood and COVID-19 she suffered in 2020. Her family history has a predominance of cancer. Father died of cancer. Patient was not able to recollect what type of it. Mother died of cervical cancer. She was able to say बच्चेदानी का cancer था, or brother disease of cancer. So that much information we were given. The mental attitude of the patient was a bit skeptical. She was not very inclined towards homeopathic treatment. Hers was a first experience. She used to get angered easily on trifles. Her expression of anger was either loud shouting, never violent. She had a strong fear of cancer, we could count as a disease also. Emotionally, she was sensitive. If somebody used to say anything, she was easily affected. Anxious for family, swelling, reserved. She was not able to express her mind very clearly. So whenever a patient comes, we take a full detailed history. In this case, it was a pathological case. A pathological prescription would be enough for us, but we have preferred that we would go for a constitutional one as the case demanded. These were the reports which were done prior to starting of the treatment. It was dominant right lobe nodule, tried 4, whereas other nodules in the left lobe were only tried 2. So this was the report which was done on 25th of March, malignancy. So it is always in the back of our mind that it can be malignant. So the following totality was considered. So here we have thought of thyroid swelling, where that constipation skips a day, profuse sweating on scalp. I had considered headache also, aggravation, sun exposure, irritability 3+, fear of cancer or fear of disease, introverted and reserved. Now, I would like that the audience also help me out, that which medicines they think about this. Considering this, only this much of totality, because when we get a patient, we just consider few medicines which comes. A repertorial approach, if someone is taking, it's well and good. But mostly I take only taking inductive logic, like we select few remedies according to the totality which we get. So anybody would like to give some medicines which we can consider?
Carcinosin?
Yes, sir. Carcinosin? Calcarea? Which one, ma'am? Calcarea? Car. Wonderful. And any other?
Nitramune.
Perfect. A few more if someone can add. Punayam we can think about.
Calcarea iode.
Calcarea iode. Yes, sir. Iodum, excellent. Here I consider few remedies. So that was calcarea carb as we sort of, iodine, spongia, natrum carcinosis. Every remedy over here listed is having a scrofulous affinity. So all are glandular, having glandular affinity, wherein they also have an affinity towards thyroid gland. But then we have to cut down which remedy we want to take and which we don't want to take. So let's start with spongia. Spongia happens to be the most marked remedy in goiter. Any thyroid swelling having enlarged large nodule form would always point towards spongia. But I chose, but spongia would also happen that in spongia there is a compression symptoms. The nodule is so enlarged that the patient would develop a compression symptoms due to the swelling, in which normally patient feels breathless when lying down or sleeping. Another factor of the enlargement in spongia is that it varies in size. Sometimes it is larger, sometimes it is smaller, and it varies in size. In this case, as the enlargement was uniform, there was no compression symptoms. We have and associated, there was no pain, whereas in spongia there is always a pain, which is very tensive. Whenever the patient moves his head or neck, will develop that kind of pain. But in this patient, there was no pain, there was no compression symptoms, so we have ruled out spongia. Let's come to iodine. Like ma'am say, iodine would be a choice of drug. It's having tremendous glandular affinity, painless, no pain. Swelling does not account to have any pain. The glands are, but it has an emaciation associated. If a thyroid swelling is there and we think that there is a hyperactive nodule, then we can always think of iodine, wherein there is a patient is emaciating, she or she is losing weight, muscle mass. Along with that, there is a ravenous hunger. This patient was not having any difference in appetite, so iodine was ruled out from the picture. Natrum and calcarea carb comes very close in this. Natrum also covers almost all the symptoms except for the fear of cancer. But then also, natrum also is very irritable. The irritability of natrum is that they are very sensitive, very touchy. They hold their emotions which was there back, and they are, if someone offends her slightest, they feel it and they are irritable on triples. In this case, that was okay, but the patient was introverted, reserved. Natrum also has a very introverted personality, reserved. Headache, also sun exposure. Natrum also was one of the thought remedy, and calcarea carb. Calcarea carb covers almost all the symptoms along with the fear of cancer, fear of disease. So we have selected calcarea carb here. Calcarea floor is always given in biochemic in our practice. The reason is that is a homeopathic supplement. It helps in dissolving any mass or nodule. So it is always, along with any medicine, we tend to give a biochemic prescription. Carcinosin, will look into it once we move forward. So out of these medicines, I chose calcarea carb. As the pathology was advanced, and we have considered it more towards that, and patient sensitivity was not that much, so it was given in a medium to low potency. So I chose calcarea carb 30. Was there any progress with this medicine? So well selected, everything was matching at that time. We thought it will give a good result. When patient is so skeptical, they keep us under pressure. Madam, abhi kya hoga? Madam, kab theek hoga? That always they keep on asking us. The result was not there. So there was no significant change. The swelling was same. Patient was getting restless and little anxious about the treatment. we did a re-case taking, re-evaluation after 2 months of treatment. Nothing much was found, but there was a predominant psychotic history wherein the child has a tonsillitis in childhood. She also said she had suffered from pneumonia in past, and a little bit that uterine fibroid was there, which has created the metrorrhagia during menopause. Not much was selected. As the patient was lean thin, narrow chested, dark complexion, looking at having that iode molecule in it, I chose Calcarea iodida. Thinking it will cover, and Calcarea iode also covers most of these symptoms. Given a prescription of Calcarea iode 30 thrice in a day for 7 days for almost 1 month, a remarkable change occurred. The swelling started reducing, and it was not increasing also. So things were in a declining phase. At some moment, we do found that there was some improvement was not happening as our expectation was. At that time, carcinosin was given 3 doses per month, and the results are there to be seen.
Potency, carcinosin.
200. 3 doses. 3 times in a day. So 1 day or in a month we selected carcinosin, and then every thrice a day, once in a month, that's enough. And here the carcinosin, as sir said very well, there was a cancer predominance in this case, so carcinosin was a drug of choice. Compared to then the patient went for a scan. The thyroid swelling had completely was not much visible. So patient went for a scan after 9 months. Compared to that, previous scan, the sonologist himself has written, compared to that, the Thyroid nodule has significantly reduced. So this is one of our achievements. So we are happy that when Thyroid 4 nodule is there, it's always likely that it will be malignant. But when it is shrinking, it is one of the good results. So this is the nodule which we can see, how it is shrunk down. It is completely disappeared right now. We hardly see the nodule. I had asked the patient for this 2024 report to be done, but the patient is not yet gone for it. But whenever she does, we'll share it in the group. Here we have found that, whenever we learn from our patients. We learn from them. They are our great teachers. They motivate us to do better. In this, there is a learning which I would like to share, that all cases of thyroid nodules, we should always try with homeopathic treatment. It will not only reduce the growth, it might stop the growth. So always try for homeopathic treatment in any chronic case. If the totality and the picture matches, the results are there to be followed. Always encourage the patient before choosing any surgery. This not only benefits the patient, but it is also a goal of ours that homeopathic fraternity, the faith of the people in homeopathic fraternity will increase. Now this patient is so pro to homeopathy that she will always prefer to take homeopathy first as a first line of treatment than to take any allopathic medication. There is nothing wrong in taking emergency surgical treatments, but always opt for homeopathic treatment prior to any of these, any impending surgeries. Is there any doubt anybody would like to come up with? I'm grateful for this amazing people, my colleagues, my senior homeopaths who had been my mentors, and to present in front of you and to express my gratitude. I'm expressing my gratitude to all of you. I'm thanking you from bottom of my heart to give me this opportunity and to at least present this case in front of you. Thank you for being a patient listener.
We are proud of you.
Thank you.
All the best for all the future. We look forward for further lectures.
I wanted to express my sincere gratitude for this dedicated presentation. Thank you very much, ma'am. Now I'll request my colleague to felicitate our chairperson and a speaker. I'll call upon Dr. Kelly, Dr. Meenakshi, please do come.